Health Minister Andrew Little's with us. Very good morning.
Good morning, Mike.
How big an issue?
Obviously significant. There've been that number of health staff having to be stood down for a period of time now at a time when that hospital is under pressure. That is significant. I think we do need to know how the judgment call was made at the time that the guy was starting to get a fever, and that was the one symptom of COVID that people were worried about, and he was swabbed, and he wasn't isolated at that time, so he was left for several hours with other patients in that 4-bedroom room. So we do need to know kind of why that judgment call was made. In the meantime, the right steps are being taken, but it is going to cause more disruption.
What's your sense of it from what you know? Was a mistake made or not?
Well, the advice I've had is that he was properly screened. When he had turned up at the emergency department, he was properly screened. He was asked, have you been at a location of interest? Have you got any of these symptoms? And all that checked out. And so there was nothing to indicate that he was at risk of COVID. And it wasn't until the following morning when he started displaying the fever symptoms that then the health staff were worried and then took the swab.
Because it would be inconceivable that 18 months in the hospital of all places would be not following proper protocol, wouldn't it?
And that hospital in particular, Middlemore is probably the one hospital that has dealt with the most COVID patients, has the most rigorous infection prevention and control measures. Yeah. It's got 2 COVID wards. They know how to deal with COVID and manage COVID patients. And so for something like this to happen, there are some questions that still need to be answered.
All right. Talk to me about testing. Bloomfield seems to think we need 7,000 tests a day in Auckland. How can we test if there's nothing to test for? People don't not turn up, or do you think they're not turning up?
I think there's a sense that people, even some with symptoms that are the symptoms of COVID, even though they might not have it, are not getting tested at the moment. There is that thing about just getting a general kind of surveillance level of testing so that we can pick up the people who are asymptomatic and in case the infection has kind of broken out anywhere else. So there is a level of testing that you want to do just to check that the virus isn't in places where we wouldn't otherwise be looking.
Because it seems like a threat. Unless we get to 7,000 tests a day, there's no hope of getting out of level 4. Do you think it's a threat?
No, I don't think so. That would be determined by the number of infections that are popping up each day. But one way to just gauge whether or not we are on top of it and we are getting all the infections that are happening is through that surveillance testing.
Do you think people would test more easily if they didn't have a thing stuck up their nose and they could do a saliva test?
Yeah, and I think that we're certainly dealing with that at the moment. There is some saliva testing. It's about 800-odd people who are having regular saliva testing. We do need to expand that, and the Ministry is in talks with a provider for that service. I think one of the issues has been the sort of early saliva testing kits that were around. There was a high degree of kind of false positives and false negatives for that matter. I think the technology is better now, but we, in terms of the government and our working with the Ministry, we are very keen to see more saliva testing rolled out because it is way less intrusive and uncomfortable than the thing stuck up your nose.
Re the vaccine. I looked at the numbers for the DHBs the other day, and it was last week, so it will have changed a bit, but the worst was 15%, have been double jabbed. The best was 30-something%. That's an unacceptable variation among DHBs, and it's all on the DHBs, isn't it?
Yeah, well, that's part of the program, and since the middle of the year has been on the DHB since about May. I think the DHBs have been responsible for the program rollout. And most have actually done a great job in expanding and getting up, but it has been variable. That is true. But I think generally speaking now, they are pretty much all DHBs have got on top of what is required, got the vaccination centres set up, getting the volumes through.
Okay. Is there an active program? Because one of the criticisms of your government this time around, apart from a number of other things, is that the capacity in ICU, the very reason we locked down, has not been expanded. Is there an active program to expand the capability and capacity of ICU in this country?
Yes, there is. We have right now the kind of business as usual capacity is about 326 ICU beds across the country. We can surge to 550 if we need to. In order to get there, we've had to provide additional training, particularly for nursing staff. So since about the middle of last year, we provided additional training to roughly 1,200 nurses who can step up into ICU type work. We've also worked with DHBs to make sure that there is bed space they've got that they can convert to ICU services if they need it. That has been a little more variable. Some DHBs have stepped up to it, others haven't, but that program of work is continuing.
Is Novavax the booster jab of choice, do you think?
Well, Novavax hasn't been approved by
no, but eventually when it is.
New Zealand, so Well, let's see. I mean, I haven't seen any reports on it. We haven't got the advice on it because it gets approved by MedSafe, and then the government has to approve it for use.
Yeah.
And we do that on the basis of.
But you'd also be then mixing and matching, wouldn't you? Why aren't you going naturally with Pfizer? Are you worried about the efficacy?
No, I think other countries have have used more than one vaccine, in people.
Yeah.
So they've had a mix of vaccines, and it seems to be reasonably effective. So I don't think there's anything specific that says you can't mix your vaccine.
No.
But look, we haven't got the advice on that yet.
All right, appreciate your time. Andrew Little, who is the Health Minister with us this morning, is 16 minutes away from 8.